The senator from California.
Mr. President, thank you very much. I listened very carefully to my colleagues predicting gloom and doom, and it brings back to me what I have read about what happened when Medicare was brought to this country by the Democrats and what happened when Social Security was brought to this body and to the House after the Great Depression. And I'm going to go into that in a little bit. But somebody said this, reminded me that one of the definitions of insanity is doing the same thing over and over and expecting a different outcome. The Republicans in the House have voted 42 times to repeal the Affordable Health Care Act or to defund it. Health care reform has taken years and years. We finally got it done, and millions of Americans are on the cusp of getting health insurance for the first time. And Republicans are desperately trying to block this from happening. 42 times, and we told them. Senator Reid couldn't be more clear. We're not going to delay health care for the people of this great nation. We're not going to go back to the days when people with a pre-existing condition were left to die without health care. We're not going back there. And yet it continues. Now, the Republicans are so adamant about it that a very large group of them are threatening to shut down the government of this great country. And again, it's not like they didn't do this before. The Republicans did this before. It was a disaster for the people. People got hurt. They didn't get paid. Business was disrupted. Social Security and Medicare were disrupted. Veterans' benefits were disrupted. Parks were shut down. People were hurt. And it cost a fortune for the taxpayers. But somehow, Republicans feel they can play games. And I think it is a shame. Now, my colleague, Senator Cruz, spoke for a very long time and said that he would speak until he dropped. He said that over and over. I will speak till I drop. Well, if he were to drop and suffered some kind of health episode, which he apparently was willing to risk, he would have had health care because he's insured. If he had to be lifted up on the floor of the Senate and driven to a nearby hospital, Senator Cruz would have had great health care. Why does he want to stop that for millions and millions of hard-working Americans? And only he can answer it. I could only say that as I listened to some of his interviews, it sounds like what he's feeling in his heart is, if this goes into effect, the people might like it, and woe is us. Because there's an ideological split here in the Senate, where we have senators and House members also in the House who don't think that there's any role for the federal government to play in making people's lives better. Some say military spending, fine, highway spending, fine, but when it comes to lifting people up and giving them a quality of life and helping to do that, oh no, oh no. So Ted Cruz is fortunate. If he talked till he dropped on the floor, he would have had the best health care. He would have been on his feet and super fine. There's a lot of people out there who are dropping because they put off going to the doctor because they have a condition and they have no insurance. And when they drop, They have to go to an emergency room where they could be patched up, and by the way, taxpayers pay for that. So here's the thing. We have the Affordable Care Act, which Republicans call Obamacare, so that's fine. Obamacare, Affordable Care Act, whatever you want to call it. It is based on a Republican-suggested model of health care, where you use the private insurance, you go to an exchange, there's a lot of competition, and I'm excited about it, frankly, because in my home state of California, we're on board, coveredcalifornia.com. That's what you do. You go up, if you're a Californian, coveredcalifornia.com, and you find out how you can get health care. Some people will apply and get a Medicaid card, the working poor. The middle class, they'll be able to move forward and go to the exchanges, and many will get a subsidy to help them if they're in the middle class. Now, here's the thing that really shocks me. Republicans act as if this health care bill, this affordable health care, Obamacare, just came down off the ceiling and dropped on the floor here and became law here. It took a long time. Senator Baucus worked and worked and worked and worked. We took many Republican amendments. We passed the bill. It became the law of the land 3 years ago. They took it to the Supreme Court, said it was unconstitutional. The Supreme Court said it was constitutional. And now that it's about to go into play, Republicans are willing to shut the government down to stop it. It was a centerpiece of the 2010 election. We all know that. Mitt Romney said, if I'm president, I'm getting rid of that law. And the people of the country said, okay, what are you going to put in its place? Well, let's see. We'll allow insurance to go across state lines. Well, what does that do for me if I have a pre-existing condition? They wanted to replace it with nothing. American people are smart. It doesn't mean this law is perfect and we can't make it better, but let me tell you, many of us served under many presidents. I'm looking here at my colleague from Maryland who served a long time in the House. I served with 5 presidents, a couple of whom I didn't agree with. And I did everything I could to fight against the legislation that they liked that I felt was bad. But once it passed, I didn't try to shut down the government. I tried to work with everybody, and I'm not an exception. That's what we used to do around here, all of us. Suddenly, it's my way or the highway. I'm taking my teddy bear, my blankie, and I'm going home because I don't like the Health Reform Act. It doesn't suit me. Some of them are so angry about it, they're trying to take away the employer contribution from their own staff. What an outrage. Hardworking people who love their country, who work here. Now, let me tell you, earth to the Republicans. A, you lost the election, not only for president, but in the Senate, where colleagues who supported the Affordable Health Care Act got elected. B, President Obama was reelected. Mitt Romney lost. Health care reform was a major issue on the campaign trail. So wake up, smell the roses, put a smile on your face, and know you tried. But don't shut down the government. Enough already. Now, I want to spend some time showing you how the Affordable Care Act is already working. So I have some charts to go over quickly. In my state, over 1 million Californians are already newly insured. And this includes, in my state, 400,000 young adults who are now on their parents' policies. If the Republicans have their way and they defund or repeal Obamacare or the Affordable Care Act, What's going to happen to those young adults? They'll be kicked off of their parents' policies. Is this why Mr. Cruz stood on the floor for hours and hours until he would drop? To hurt young adults? 3 million of them nationwide? 71 million Americans are getting preventive care, like checkups and birth control and immunizations. I don't know how many of you heard Senator King from Maine today talk about his own experience when he worked here as a young man and had insurance, so he got a preventive care checkup, which came along with his insurance. They found a melanoma. Had he not gone to the doctor and had they not seen that mole that turned cancerous, he said, and I quote him, he would not be here anymore. Health insurance saved his life. So I want to just rhetorically ask Senator Cruz and the Republicans supporting him and this body in the House, why would you take away free preventive care and immunizations from 71 million Americans and consign them to a status where they are absolutely sitting there without any protection because they have no health insurance? Let's see what else we have already achieved that the Republicans want to repeal. They want to repeal. 17 million kids with pre-existing conditions like asthma and diabetes can no longer be denied coverage. And if you ever saw those pictures of a child gasping for air, you know that those kids need coverage. They need help. And they need to be able to get that help and get the medication when they need it. Insurers can't cancel your health insurance because you get sick. How many stories did we hear, Mr. President, as congresspeople and as senators, where people went to get insurance and they said, sorry, 25 years ago you had a suspicious mole and we therefore are not going to insure you. Or you have high blood pressure, or 10 years ago you had cancer. No more. And how many times have you heard the stories where people were kicked out of their insurance because they hit a lifetime cap? That's no more. Republicans want to repeal all these benefits. And Ted Cruz was willing to talk until he dropped so that these benefits can be taken away from our constituents. Now, I heard my friend from Wyoming, Senator Barrasso, say health costs are rising. They're rising like never before. I guess he missed it when President Clinton told the country health care costs are growing at the slowest rate in over 50 years. 50 years. And that's because more people are getting covered, and you don't have to treat people at the end game or in an emergency room because we're already seeing people get more health coverage. And insurance companies now have to justify a premium hike. Before, they could double your premium. Now they have to justify it and make sure that 80% of the premiums they get are spent on the policy holders. So in 2014, and we're around the corner from that, unless Ted Cruz and his Republican friends have their way, there will be no more coverage or extra charges for pre-existing conditions. Right now, it's just children have that benefit. But 2014, everybody gets it. In 2014, no longer can insurance companies charge women more than men for their coverage. This is a huge issue. There was gender discrimination. Being a woman was considered a pre-existing condition. Being a woman who was abused by her spouse or her boyfriend and she walked in and the insurance company found out, that was considered a pre-existing condition because she might get beat up again. So she was told, take a hike. That can't happen anymore. and they cannot impose dollar limits on the amount of health care spent on you in a single year, where right now, if you have a serious illness, they could say, sorry, you reached your annual cap. So where are we now? Obamacare, or called the Affordable Care Act, is already in effect. Republicans want to stop it because in 2014, when those exchanges open, they know people are going to like what they see. I'm telling you, when I go home and I go to community health care centers, people are so excited, and not enough of them know about it, but when they find out how easy it is, if they qualify for Medicaid, they just get their card, they're covered. And they no longer have to sneak into the emergency room when a problem gets so drastic. And all the others will have options. They'll be able to choose from a platinum plan, a silver plan, or a bronze plan. And we are very excited about this law. And Senator Cruz says he'll stand on his feet till he drops to stop my people and your people from getting health insurance. You know, he's met his match in us, because we can stand up until we drop. But you know we don't have to do that because we have the votes. And the reason we have the votes is this was what the last election was about. Now, in closing my presentation, I wanted to share with you a very brief history of what happened when Social Security was proposed. It's so interesting. In 1935, after the Great Depression, and our great-grandparents were lying in the street and had nothing, and people were jumping out of windows, they had nothing. They'd lost their home, they'd lost their job, they had lost their savings. There was no safety net. This is what President Franklin D. Roosevelt said when he signed the act in 1935. We can never insure 100% of the population against 100% of the hazards and vicissitudes of life. But we have tried to frame a law which will give some measure of protection to the average citizen and to his family against the loss of a job and against poverty-ridden old age. This law represents a cornerstone in a structure which is being built, but it is by no means complete. Franklin D. Roosevelt. So he spoke about the safety net. And 1935, just think about that. And let's see what happened in the debate. Let's look at what happened in the debate. Representative William Ditter, from a Republican from Pennsylvania, took to the floor and said, "Security for the individual, whether worker or age, will be a mockery and a sham if in the attainment thereof we allot to our people the role of puppets of a socialistic state." Where have we heard that before? He called Social Security part of a socialistic state. We cannot provide a sense of security by programs for the destruction of wealth. We cannot assure to the people a sense of security by measures threatening their investments of life savings. Could this guy have been more wrong? Could this guy have been more wrong? He called Social Security socialism and said it was going to destroy wealth, when in fact it preserved our people in their old age. Now here's another, Representative Jenkins of Ohio, Republican. He talks about Social Security this way, Mr. President. This is a compulsion of the rankest kind. Do not be misled by the title. The title of Social Security says old age benefits. Shame on you for putting such a misleading and unfair title on such a nefarious bill. Old age benefits? Think of it. What a travesty. Mr. Chairman, what's the hurry? Nobody's going to get a dime out of this till 1942. What's the hurry about crowding an unconstitutional proposition like this through the House? Now, honestly, this is what we hear them say about affordable health care. Socialism, unconstitutional, it's a sham, we have plenty of time, we should delay it. History is repeating itself right in front of our eyes. Now, it didn't stop then. In 2005, Republicans continued to attack Social Security. President George W. Bush and Congressman Paul Ryan wanted to do away with Social Security as we know it. We all remember that. They proposed abolishing Social Security and replacing it with private accounts in the stock market. And we all know how safe that is. I'm a former stockbroker. You don't buy stocks when you're ready to retire. That's their plan. Had this become law, seniors retiring in 2008 would have lost up to $26,000. But we stopped them, and we didn't allow it to happen. And lastly, let's look at Social Security's success. Before Social Security became law in 1935, half of America's seniors lived in poverty in the midst of the Great Depression. Half! Today, 57 million Americans receive Social Security, and it lifts 14 million elderly Americans out of poverty. It is the most successful and the most popular anti-poverty program. The Republicans said it was unconstitutional. They said it was socialism. They said it was a sham, a disaster. And they're back here saying the same thing, just as we're on the cusp of delivering a benefit to so many, probably 50 million Americans. So this is my last discussion about Medicare. When President Lyndon Johnson signed the Medicare Act, he said, "No longer will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that have so carefully been put away over a lifetime so they might enjoy dignity in their later years. No longer will young families see their own incomes eaten away simply because they're carrying out their deep moral obligation to their parents, to their aunts and uncles." This was President Lyndon Johnson in the 60s. Some of us actually were around in the 60s, remember it, and this is what the Republicans said about Medicare. Listen carefully. This is a history moment here. We're looking at what the Republicans said every time we were about to get a new benefit for the people of this nation. 60% of Republicans and 50% of House Republicans, 60% of Republicans in the Senate and 50% of House Republicans voted against Medicare. Representative Durward Hall of Missouri, Republican, said, "We cannot stand idly by as the nation is urged to embark on an ill-conceived adventure in government medicine, the end of which no one can see, and from which the patient is certain to be the ultimate sufferer." This is what the Republicans said. And Senator Millward Simpson of Wyoming said, "I'm disturbed about the effect this legislation would have upon our economy and upon our private insurance system." Well, of course, what we found out is this turns out to be one of the most successful programs. Medicare is a success. Before Medicare became law, the majority of seniors had no health insurance. Today, nearly all seniors are receiving guaranteed health care benefits. 8 out of 10 seniors aged 65 and older feel the program is working. With few exceptions throughout its history, Medicare has been more successful than private insurers at holding down costs. And we still have to fight for Medicare. I need to see the Medicare chart. We still have to fight. In 1995, Dick Armey, the Republican House Majority Leader, said, "Medicare is a program I would have no part of in the free world." Bit of an overstatement. Dick Armey. That same year, after leading an effort to raise premiums and costs for seniors, Newt Gingrich predicted Medicare was, quote, "going to wither on the vine." Senate Majority Leader Bob Dole bragged in 1996, "I was there fighting the fight, voting against Medicare, because we knew it wouldn't work in 1965. And Paul Ryan's budget ends Medicare as we know it today. So all this brings us to the moment we're in. Now Republicans are trying to defund the new health reform law. And John Boehner, Speaker Boehner, said, "Passage of health reform is Armageddon because the law will ruin our country." They said it about Social Security, they said it about Medicare, and now they're saying it about the Affordable Care Act. And the Republican Party platform in 2012 said, Obamacare was the high-water mark of an outdated liberalism, the latest attempt to impose upon Americans a Euro-style bureaucracy to manage all aspects of their lives, unquote. So, I felt it was important to put into the record the historical context of the battle we face today. I try to tell my kids and my grandkids, when we fight these battles, we sometimes forget the context, that it's not that much different than what went before us. We look different, certainly the women here weren't around here then, but the fact of the matter is they're the same battles. It's about what is the role of the national government of the greatest country in the world. And I certainly, for one, believe making life better for our people and doing it in a smart way and a fiscally responsible way is the way to go. We'll have to make our changes to the Affordable Health Care Act if we see we can make it better, and we invite our Republican friends to work with us. I was one who didn't vote for the drug benefit because I didn't like that big fat donut hole that came in there, which put people on the spot. They had to stop taking their medicine. They couldn't recover money. But we worked with our friends, and we ended that. And by the way, we did it in this bill, the Affordable Care Act. So yes, working together, yes. But standing up until we drop in order to stop important benefits from going to America's families, that's wrong. I yield the floor.